Well, that was unfortunate. I got kicked off and my computer auto updated. Thank you for coming back on. See if anybody else joins here shortly. There's some people coming back on. Okay, we got some people back here. All right, everybody's kind of signing back in. This is awesome. All right, good, good, good. All right, guys, give me a minute here to reconfigure. So unfortunately, technical difficulties. My computer decided that it wanted to do an automatic update in the middle of my talk. So that's always fun. Let's get you guys back into the video here. All right, we're back. Thank you guys for signing back in. All right, so where was I? Let's get back to where we were. Again, I apologize. Some things you just got to work through, you know? But here we are. So like I was saying before, the meniscus surgeries in 95% of cases, they're really just removing the meniscus tissue. That's what you need to kind of keep the joint cushioned. So research now shows that actually removing that meniscus tissue just speeds up the onset of arthritis. So you're actually just making that arthritis worse faster. So the idea is to stop cutting stuff out and instead using these biologic agents from your own body to actually help the tissues recover. So the conditions that we commonly treat are very similar to conditions that you would see in your normal orthopedic office. So spine, shoulders, hips, knees, ankles, sort of all over the body. I usually say that we treat any joint basically from the top of the head to the tip of the toes. So you can see here, most of this stuff is what people would typically present to an orthopedic clinic to have treated. This is all the stuff that we do in our office with just injections. So Regenx has been treating patients as a network since 2005. That's when they started doing procedures in the orthobiologic field. Regenx Pittsburgh became a part of the Regenx network in 2012. We were one of the first networks to actually, or we were one of the first practices to actually join into the Regenx network. So we've been practicing with them for quite a while. And we've done many procedures as a result of being in the network for so long. So today I kind of want to talk to you about what matters. Like when you're talking about orthobiologic procedures, regenerative procedures, there are a lot of different pieces of information that people will hear from a lot of different sources. And it's a little hard to discern what is actually important and what is not so important. So we'll talk first about what matters when it comes to regenerative procedures. Number one is physician expertise. When you have these procedures done, you want to have them done, obviously, by a physician that knows what they're doing. At Regenx Pittsburgh, we've done over 3,000 stem cell procedures, and we've done over 12,000 PRP procedures since 2012. I've been with the practice since 2015, so I've definitely been a part of a majority of those procedures. We're physician experts. Like I said, we hold certifications in PM&R, pain medicine, and sports and spine medicine. So we're trained at a very high level to deliver these treatments very effectively. You actually get a physician when you come into our practice. You're not going to get a physician extender, PA, nurse practitioner. You're not going to get a fly-by-night chiropractor or another naturopath, somebody that took a weekend course on some of these treatment deliveries and don't necessarily have a whole lot of specialized training in how to deliver these things. We are all master certified to be able to do all of the different procedures that fall under the Regenix umbrella, and we're able to do them at a very high expert level. The second thing is diagnosis. To actually figure out what you want to treat and treat it effectively, making the diagnosis that actually matters is the actual first step. So you need to make the correct diagnosis to perform the correct treatment. If you aren't a specifically specialized trained musculoskeletal physician, you're going to miss the diagnosis in a lot of cases. Man, I'm telling you what, this computer is just not having it tonight for me. I'm sorry, guys. Bear with me for just a second. I'm not really sure what's going on with this. All right, we're gonna try again. Again, I apologize. I've never had this many technical difficulties with one of these before. Thank you guys for hanging in there for me. All right, where are we here? Back at it. All right. So like I said, you want to be able to figure out exactly what you are treating. You want to be able to do that effectively. You want to make sure you're getting the right diagnosis, and you don't want to do unnecessary treatments on things that maybe are not what people need to actually feel better and get better. Image guidance is very important also. Like I said, all of these treatments are done by needle guidance, but to be able to effectively perform a needle procedure, you have to know where that needle is going. The way that we effectively do that is through ultrasound guidance and by fluoroscopy, which is X-ray imaging. So that allows us to actually see the needle placement in real time. We know exactly where the needles are going and what areas they're treating. We can comprehensively treat not only joints, but we can also treat tendons, we could treat ligaments, we could treat muscles, we could treat nerves, we can treat all of the things that matter in terms of making the joint as healthy as possible. So it's the most effective way to actually enhance the healing response, reduce pain with the procedures, because you're not sticking the needle somewhere where it's not supposed to go or you don't want it to go, and it helps to restore function faster with less pain after the procedures. So cell types are very important. The mesenchymal stem cells, or the bone marrow containing the stem cell concentrate, is actually derived from the bone marrow in the body, and it's FDA compliant. The FDA considers use of adipose or certain fat treatments illegal within the United States. So there's certain techniques that are being done out there that are actually not compliant with the FDA standards. We are compliant in all ways with the standards that the FDA puts on these procedures. And also the FDA considers products like placenta, amniotic tissue, cord blood, Wharton's jelly, and anything else on the market that is proven to have no cells in the mixture as illegal commercial products. And they're putting a big crackdown on the market right now for those things. So anybody that mentions those types of cell products to you, it's something that I would be very skeptical of and probably would not proceed with. Dosing matters. So these procedures are not a one size fits all sort of approach. We look at the very specific elements of what we're treating with each individual, and we derive orders based on what we want to do with each person's specific problem. When we do that, the processing of the cells all goes through a hands-on process in our actual lab, and we're not using a bedside centrifuge like most clinics are. So we're not just a plug and chug type operation where we stick the blood in the machine, we get out whatever the machine gets us, and then we give it back. So we actually specialize the dosing for individualized treatments, and different structures like tendons, ligaments, joints, the spine, different things are going to require different dosing, different types of cells to actually get the job done effectively. And then safety matters. We want to obviously do these procedures in a very safe way for you. Regenx actually published a paper a few years ago that looked at over 2,500 patients to see what the actual negative impacts of these treatments would be. And really the most common complication that they saw across the board was really just discomfort and pain at the injection sites. So basically what that tells us is these procedures are extremely safe. There's a 0% risk of infection with these treatments. We've never had an issue with infections. Pain during and after the procedures is minimal and very short-lived. You only have about 1 to 3 days of true downtime after these procedures. Extremely low risk for complications, certainly less than the 300% increased risk that you would have after surgeries. And again, using the guidance with fluoroscopy and ultrasound helps to eliminate complications with the procedures both during and after. So research is also very important. Like I said, Regenx has the stronghold on the majority of research within the world of stem cell treatments. So if you have, so Regenx has completed about 40% of the world's research on orthobiologics in general. They also have the largest registry, meaning that they've tracked over 35,000 patients through the actual process of these treatments nationwide to see how these patients respond to treatments from time zero, like from the time that they walk in the door. So it's not a registry that just cherry picks data from good outcomes. It's the data from every single person that wants to participate in the registry from before the time they have the procedure all the way through their follow-up as far as we have followed them. So the science and the consistency of that registry shows that what we're doing actually works, and we work to make that better so that we get better outcomes for the treatments as we move forward. So we're always working to make the treatments better. We're always working to give people better outcomes and better effects. So if all of that matters, then what doesn't matter? That's another very important question. So one thing that patients get concerned about is weight. A lot of surgeons will tell patients, well, we can't possibly do surgery until you lose 50 pounds or, however much it's going to be required for that to be effective. Weight has not really been shown to be a factor in treating knee OA within the Regenx treatments. So many people who have been eliminated from surgery or are considered not good surgical candidates because of their weight are in fact good candidates for the Regenx procedure. And I've done these treatments on patients of all shapes and sizes, and most people across the board have excellent results. Age is another factor that people have a lot of questions about. Age does not matter. A lot of people are told, my stem cells are too old. I'm too old to have stem cell treatments. My stem cells won't regrow. All of that is nonsense. Your stem cells are still as effective in your body now as they were when you were 25 years old. So your stem cells still work the same way. They still are as effective. As you age, there is a slight decrease in stem cell counts, but because we work so hard to proprietarily get the most cells out of your body when we draw the cells, we always get enough cells to treat effectively when we're doing that. So research has shown that stem cell treatments work just as well in the elderly as they do in younger patients. I've treated patients that are as old as 14 all the way up to age 98. So, even if you're in the upper age categories, you're still plenty good candidate for these treatments. So the next thing is the degree of osteoarthritis. A lot of people come in and they say, well, I'm bone on bone. There's probably not anything you can do for me. Well, this is who we treat in most cases of people that come through the clinic doors. We can save you from a joint replacement, even if you have bone-on-bone arthritis most of the time. This is on this picture on the right here is a picture of a severely arthritic joint where you have that more bone-on-bone look formation. These are the people that we see all the time. This is the x-ray that I stare at day in and day out in the clinic. Bone marrow concentrate treatment in these areas can work for many years, and it can be repeated if it's necessary. The actual most recent research showed that the treatments that we're currently doing for advanced osteoarthritis in the knee have shown to keep people away from surgery 80% of the time for up to 15 years. These treatments are very effective for long periods of time, and that's being shown more and more in the research as time goes on here. So we'll kind of take a step back from stem cells, talk a little bit about PRP. PRP is your cells or your body's platelets in the blood supply. Platelets contain growth factors that actually help with amplifying healing. So they work in conjunction with the local repair cells, with the stem cells, and they act like espresso shots. They act like miracle grow to actually help with providing growth factors and healing factors that help these cells to repair faster. They help the cells to repair more effectively, and it makes the cells work harder and longer to actually implement a better healing response. Stem cells are actually the general contractors for the repair job. So they're telling other cells what to do to repair damage. They're actually becoming the cells that turn into the bricks and mortar and replace tissue that's damaged. They also use espresso shot growth factors to kind of amplify that response, but they themselves are what are actually turning into the tissue and creating repair. So which one is for you? Well, PRP we tend to use in smaller joints, things like fingers, toes, thumbs. We use it in pathology where there's maybe less severity of the arthritis. So if you have like mild to moderate arthritis, but you still have pain, we use it in a lot of ligament treatments or ligament sprains, strains, instability in ligaments and knees, tendon injuries, tendonitis, Achilles tendonitis, tennis elbow, golfer's elbow, lots of different pain in the hips, bursitis, all these other things. And then also in the spine. PRP is primarily what we use in the spine 99% of the time. And it's very effective in the smaller joints of the spine and around nerves. Stem cells we use more for larger joints, shoulders, hips, knees, things that we are seeing more damage, more severe arthritis. And then when we're actually treating bone, when we're actually reforming non-union fractures or areas of damaged or lost bone that need to be repaired or bolstered. I'd say these numbers are a little bit off. I think it's a little bit closer to 70% PRP, 30% stem cells. But not everyone needs stem cells. So I wouldn't just assume that if you come in to see us for specific issues that we automatically have to jump to the stem cell treatments, but we're going to take that on a case-by-case basis. So just recognize that there are other options as well. So obviously we've talked a lot about this. These procedures are super minimally invasive. This is commonly what patients will see after we finish treatments. There may be just one or two bandages on the skin, depending on what we're treating, because we can do injections from very small sites in the skin. So that leads to less downtime, again, shorter rehab, less need for drugs. Most people just get away with taking Tylenol after these procedures and they do fine. Back to work in days, not weeks or months. And for most of these procedures, you're awake. We use a lot of good surface anesthesia and anesthesia actually at the injection sites to make sure that these procedures are as comfortable and pain-free as possible. So am I a good candidate? The only factors that are probably going to keep you in some way, shape, or form from being a good candidate are things like metabolic syndrome. Are you a very highly uncontrolled, fragile diabetic? Do you have severely out of control blood pressure or cholesterol? And is your healing significantly compromised by any of those factors? That might limit your candidacy a little bit. Recent cancer is a big one. We like to have cancer remission for several years to make sure that we're not instituting any issues with that. However, there have never been any issues with cancer as far as stem cell treatments across the board, both in the Regenetics clinic and worldwide. If you are too far gone, there is a too far gone. The pictures that you see here on the screen are a joint that is severely broken down arthritically to the point where the contours of the joint are actually changed significantly. There's a severe angulation deformity. You can see we compare it kind of to the Leaning Tower of Pisa. In certain instances, if there's a mild deviation like that, we can still treat it, but there are certain limits to that as well. If people can't get off of steroids, that's a big deal because steroids actually limit your healing capacity. And then if somebody has polyarthritis, normally that's more of like a rheumatologic type condition. We still can treat you in those instances, but sometimes because of those immune responses within the body, sometimes people don't have as good of a result as they would if that wasn't present. So let's talk a little bit about what you can expect for an actual stem cell procedure. So there's 3 days that we're going to talk about that actually constitute a full stem cell treatment. So the first day that you come in, we're going to do something called prolotherapy, which is actually more where we till the soil. So we're actually just priming the joint to get the joint ready to accept the stem cells. We're going to stimulate the body's immune response to the area, injecting into the joint, injecting into the ligaments around the joint to stabilize them, any tendons that are compromised in the area, and any other structures that we need to. The heightened immune response prepares the site to take advantage of the stem cells when they're introduced a couple days later. Easy procedure, minimally invasive, not a lot of discomfort during it or after it. Some people even say that they feel better after this treatment. So the second day that you come in, this is going to be a couple days after the first treatment. This is the longer day. This is when we do the stem cell harvest, and then we do the re-injection on the same day. The stem cells are going to come from an area on the backside of the pelvic bone called the iliac crest. That's the actual source of where we can get the most stem cells with the least area of compromise. Those stem cells are going to get concentrated on site and then re-injected back into the tissue that same day. Most patients rate this procedure as a low grade 3 out of 10 pain. We do actually provide some anesthetic through inhaled nitrous oxide, laughing gas as we're doing this procedure. So most people tolerate this very well. I'm going to show you guys a brief video of what this procedure looks like. If you get a little queasy with this kind of stuff, you can always turn away from the computer. But I just want you to see that the procedure itself is very minimally invasive. The person that's having the procedure done, is very comfortable. I just want you to see how simple the actual procedure itself is. So here, we'll kind of go through it real quick. It's a short video. So we use the ultrasound to actually place the needle right onto the area of bone where we want to do the extraction from. So we know exactly where that needle is going to be. This patient has already had superficial anesthesia applied to the skin. We use a drill to actually breach into the bone. It's very quick. That's all there is to it. It just takes that many seconds, that few seconds. And then we use a little bit of anticoagulant to make sure that the cells don't clot. And then we draw the stem cells out. Super easy. This is usually the most uncomfortable part for the patient. As you can see, this patient's very comfortable, not having a lot of pain as we're doing it, not complaining, no screaming in agony or any process like that. So very comfortable. That's the end of it. Once that syringe comes off of there, the patient usually doesn't feel anything after that point, and then we move on to the next site. So it's that easy. So after that harvest takes place, the next thing that we're going to do is we're going to take those cells, we're going to send them into the lab. It's going to get processed. It takes a couple hours to do that. Once we get the cells processed, they come back to us, and then we plant the seed. So that's where we do the actual stem cell injection into the areas where the compromise is happening in whatever joint we are trying to treat. That'll happen later on that day. As I said, everything will happen in that same day. Day 3. So after that second procedure of that second day, a couple days are going to go by after that. That's the time where you're probably going to have a little bit of downtime and limited weight bearing on that joint. You come back day 3. This is going to be the fertilizer. So we do a blood draw. We take the platelets out of the blood. We process it that day. It takes about an hour and a half to 2 hours to do that. And then we re-inject the platelets into the same joint that we injected the stem cells. And the platelets, like I said, are those espresso shots that just provide that miracle grow effect for those stem cells and make the cells work harder and longer for a better healing outcome. So really the idea behind the whole Regenexx process is getting you back to life, getting you back to a good quality of life, getting rid of pain, getting you off of pain medication. You know, you're not going to have a lot of pain medication or need for pain medication after these procedures. It allows you to start getting back to having fun with your loved ones, with your family, improving your finances because you don't have a lot of downtime from work and you can do the things that you want to do, improve your fitness, improve your relationships, basically overall, just get back to what you want to do. This video is actually of a young lady, Julie, who is from Pittsburgh, who actually had the Regenexx procedures done back in 2014, 2015 for avascular necrosis in her knee, which is a process where the bone cells are actually dying off. And she had amazing results and got off of crutches that she was having to, that she was requiring for ambulation for about 2 years. Her story is really impressive. So for you, what are the next steps that you need to do? Really, it's going to just be about coming into the clinic and seeing us. In most cases, you do not need a referral to come and see us. So you don't have to hassle your PCP or somebody else about it. Just call the clinic. Usually we can get you on the schedule, no problem. If you're worried about gathering imaging, if you have it, bring it. If you don't have it, don't worry about it. We can get more if we feel like we need it. We also do some ultrasound evaluation on that day if we feel that that's going to be helpful. Give a call to our office. Our Regenexx liaison will walk you through making an appointment, you know, whether that's in person, which we prefer, or telemedicine. And then, like I said, we'll determine if you're a candidate and we'll determine what kind of treatment we can do. We'll do the treatment. You can rehab with physical therapy and you can get back to life ASAP. So step 1, like I said, make an appointment. We're local doctors. We all have physician specialties. We have the training. We have the imaging. Give us a call. Come and see us in the office. It makes it a whole different experience when you can actually talk to us and we can talk through everything and know specifically what's going on with your situation. Get an exam. The exam matters. Like I said, the diagnosis is very important. The diagnosis matters. So it's important for us to lay hands on you. It's important for us to actually know what we're dealing with this joint. How structurally sound is it? How do you feel moving and walking around? We're going to spend probably the better part of an hour with you. We're going to do the exam. We're going to look at some ultrasound if we need to, and we're going to answer a lot of questions for you and give you a good candidacy and description of what we want to do. Then we move forward with the treatment if we feel that's appropriate. Like I said, little to no rehab. Rehab's about 1/6 of what you would normally experience from a surgery. So we're not trying to beat you over the head with a lot of rehab, but it is important afterwards. So it's helpful to be able to do that. But in most cases, people can do that with less pain. It's much easier. The recovery is much better, and you're able to progress with function much more effectively. No pain meds, minimal to no pain meds, minimal to no missed time from work or just life in general. You're back to things sooner, and you're getting back up and on your feet in a much faster pace. So really 4 reasons to just take your health off hold today. You want to avoid surgery backlog and worsening of your condition. You don't have to live with it. You don't have to wait another year until you're dragging your leg behind you, figuring out if you can get up out of bed that day or move around just to go out and get your mail or get to the coffee. Get back to your fitness, get your weight down again, get back to good health, better blood pressure, off your cholesterol medicine, hopefully, you know, really just taking your health back into your own hands. Increasing your quality time with your loved ones. Nobody wants to spend time in pain. You know, it makes people miserable. It makes people not feel good. So we want to try to get that better for you. And nobody's getting any younger. I mean, you know, obviously time marches on. You know, the faster we can get in front of you, the faster we can get this done, the better the outcomes are going to be for the long term. So people, you know, the hard pill is Most of these treatments are not covered by insurance. A lot of people want to know financial information. The best answer that I can give you is that these treatments are all very customized per your individual needs. So everybody's kind of a snowflake with this. So everything kind of comes in a wide range of prices. So it's not easy for me to say, yes, it's going to be this. Yes, it's going to be that. The consultation with me is covered by your insurance. Any follow-ups with me or any MRIs or imaging or bracing or therapy, anything that we do outside of the actual procedures is covered by your insurance most often. Now, that doesn't account for deductibles and copays and all these other things, but I don't control that. So don't be afraid to come and see us because the insurance is going to cover that. But a lot of times when we're talking about these procedures, if you do have high copays, if you do have high deductibles, a lot of times, you may actually be paying more for traditional orthopedic surgery in combination with the amount of therapy that you need after that, and then your loss of productivity after the surgery. It all adds up. So, sometimes it comes out in the wash where you could have had this, been back to work, and really gotten back to your life faster. So the best next step, if you are interested, contact the office. Talk to Sarah. She is our kind of in-house consultation expert. She will get you set up with an appointment. She will get you set up with everything that you need to get into our office, get in front of us, and actually go through the consultation and see what we can do for you. There's no harm in you coming in and us, kind of giving you an opinion on what we think we can do for you. And you're not obligated to anything if you are sitting in there actually gathering the information. So, don't be afraid to come in and talk to us. So, like I said, avoid surgery, reduce time, get back to your life. At this point, I'm going to open it up to questions. That's pretty much the end of the talk. So I'll let you guys sort of take some time to type those in. I'll try to do my best to field those as you're doing that. I do know that I did get an online question not too long ago. It's a little bit lengthy, but the main question is, what peer-reviewed clinical studies can you provide to support your treatment other than to traditional approaches such as surgery or other things? And I guess the short answer to that is that there is a plethora of information, a plethora of research out there. It's hard to narrow it down to, one or two research articles. The Centeno Schultz Clinic has published a ton of data on these types of treatments. So what I would just say is it's probably going to be best to reach out to our clinic, to our information sector, to actually have that probably emailed to you. If you email info at rapsmd.com, you can ask for those actual articles, and we can reach back out to you with that information. So, all right, let me see here. We got some questions coming through now. Let me try to field this here. All right. Does the PRP treatment have to be repeated, or is it once and done? In most cases, we do these treatments with the expectation that, we're going to try to get as much time out of these procedures as we possibly can. Typically, when we do these procedures, patients are getting relief for hopefully years once the treatment is done. Are there times that we have to repeat it? Yes. PRP is a treatment that typically has to be repeated. We don't know how long that's going to last, but on average, I would say it's at least a couple years that we are getting people good relief with that. Next question, is there a maximum number of vertebrae in the spine that you would treat at one session? Yes, it very much depends on the situation. Most people just look at images and they say, well, you have arthritis at all these different levels, so it must be all these different levels that are causing your pain. In most cases, that's not the case. So we are a little more selective about where we treat that's causing most of the problems that you have. It's also a matter of how much blood we can use within each individual treatment. So there is such a thing as trying to do too much at once. So it's very much geared toward, your specific situation. So again, that's all the more reason to come in and talk to us so that we can examine it, we can look at the imaging, and we can really figure out what specific areas we need to treat for the most effective outcome. And the second part to that follow-up about PRP treatments in the spine is that specifically for spinal treatments, the repeat question. For spinal procedures, we tend to try to give a very comprehensive approach each time we do a treatment. We want to try to, as I addressed with the last question, we want to try to effectively treat the specific area that's causing pain. In most cases, we haven't had to repeat specific spine procedures, but sometimes we'll have to work around other areas that may be compromised or that may be causing pain. So, it's one of those things where we have to sort of really see in the clinic what kind of pain you're experiencing and what specifically we need to treat and how to approach that the most effective way. And these are good questions, guys. So if you have any other burning questions, don't be afraid to ask. Let me see what else we got popping up here. How successful are shoulder injections? A lot of that information can be found online. Again, it's very it has to do with what type of treatment we're actually doing, whether it's just arthritis in the shoulder, or is it rotator cuff issues. There's multiple different things that comprise a quote unquote shoulder treatment. So we have to kind of look at the specific area. It would be good to do an ultrasound evaluation to see not only what's going on in the joint, whether it's arthritis or whether there's some additional rotator cuff issues, but the actual success of the shoulders across the board is very high. I would say in most cases, people are experiencing anywhere between 70 to 80% improvement in most of the cases that I see and treat, and that's sustained. Next question, are older MRI images for progression of an issue helpful, or only the most recent MRIs? I would say probably the most recent MRIs are important. If you want to bring older ones, you can. Sometimes it's helpful in certain situations for us to look at that. But really, we kind of want to know what's going on right now in the terms of your progress and in the terms of your pain, because that helps us to decide how we're going to approach these treatments and what we're going to do at that specific time. So if you want to bring all your imaging, you can. Anything really is helpful. How do these injections help a hypermobile ligament? For ligaments that have laxity, basically we're trying to help with restructuring the ligament so that it actually tightens back up. Sometimes the cells within the ligament will get stretched out. The integrity of the ligament becomes compromised. These treatments do help with improving ligament stability and improving joint stability overall. Next question. Sorry to clarify with the back, say tightening a ligament with prolotherapy or PRP, that might be a few treatments and that can last forever. How do you know once the ligament is restored? That's kind of an in-depth question. You really have to look at the back more so than just the ligaments. You also have to look at a lot of the tendon and muscle structure of the spine. Has a patient had surgery in the past? Is there instability in the discs or in the other joints of the spine that could be creating pain? So it's not just so specified to ligaments or, it's hard to kind of narrow down that question so specifically. You have to know sort of what's going on with those individual segments and how you approach the treatment. Not only from very specific ligament levels, but from a more global standpoint as well. Good questions, guys. I'm waiting to see if anybody else has stuff that's popping up. I hope that I'm answering these in a way that is helpful for you. Again, the best thing is to really just come in and make an appointment so that we can sit down and talk. Because a lot of times seeing you in the clinic and actually being able to examine these issues, look at the imaging, kind of compare the exam with the images, and really sort of give you a good rundown on what we can do and how we can be comprehensive about treating these things is so much more effective than just kind of being trying to analyze it on just black and white questions. No other questions? I'm waiting to see if anybody gets. Oh wait, maybe we got one more pop up here. Okay. Does immune system deficiency disqualify you from this type of treatment? It doesn't disqualify you. It is one of those things where we look at how capable your body is at healing, and if you know have deficits in immune response, or if you have certain medications on board that limit that immune response, then sometimes the actual healing of the tissue is not as effective, because it does require an immune activation to actually help work through the healing process and the tissue recovery. So that's something that we would have to address, on a case by case basis, depending on what we're dealing with. But again, worth discussing. Any other questions? And I got to say, I appreciate you guys sticking around. I know there were some technical difficulties at the beginning of the talk, so I'm happy you guys were able to stay on board and work with me. That's really helpful for me. Wanted to say thanks. A physician and IT guy, impressive. Thank you very much. Like I said, I do my best. Sometimes you have technical difficulties, you got to work around it. But we're doing our best to give you guys the information that you need. One more question here. Great talk. Thanks for the info. There is a recording so my husband can watch later. Yeah, perfect. Yes, you guys will get a recording of this talk. I really appreciate that. You can share it with your loved ones, share it with your friends. A recording will probably be put on the website as well, so you can always access it there. Or if you can't figure that out, just like I said, email us info at rapsmd.com. That's a great way to get in touch with us, a great way to get information that you want or need. And we can communicate with you that way as well. Really appreciate you guys being here tonight and spending some time with me learning about what we do. I hope you guys are excited about it. Please feel free to call the clinic 412-963-6480. And hopefully I get a chance to meet some of you guys in person soon. Appreciate your time tonight. Have a great night. And we hope to hear from you guys sometime in the near future. Thank you again very much for your time.